Well, hello, everybody, and welcome back to another Hero webinar. I'm Paul Terry. I'll be your host. If there's one phrase I'm hearing a lot of lately in the last couple of weeks is that there is light at the end of the tunnel. We're here in April 21, and we are in the midst of what we are finally happily seeing as one of the biggest immunization vaccination campaigns in the history of the world. And one of the things that many of us are moving mentally into is what comes after. What can we make? Can we make opportunity out of this crisis? And to answer that question today, I'm so eager to learn from Emily Hu and Ron Goetzel. Let me introduce them as per usual by showing you where you can find them. And they are both busy, prolific, and really important experts for answering this question. First, let me introduce you to Emily Hu. Emily is the executive director of the Build Health Challenge, and she's also the managing director of partnerships for the de Beaumont Foundation. You can find Emily on LinkedIn. You can read a fair amount here about what's new in the Build Health Challenge. And you can see a little bit about Emily's background, career, nonprofit and private sector executive. Like Ron Goetzel, she is a proud graduate of New York University. If you want to learn a little bit about her work at the Build Health Challenge, you can find her biography here. Learn that she has had a unique perspective that brings her a passion for sustainable models for social change. Emily, what I really was taken by on this website, given your national network, is that we can, if we want to find out where you are and your good work in terms of sustainable social change around the country, a nice interactive segment of the Build Health website that I commend you to. Let me also introduce Ron Goetzel. For people who are Hero and Hero members, you need no introduction, Ron, as you know, but Ron wears two hats. He's that senior scientist at Johns Hopkins University in the Department of both Health, Behavior, and Society, as well as the mental health area. And he is also a senior scientist and vice president at Watson Health. Ron, I am about to declare you, since some of your patriots in research over many years are getting close to retirement age, where you're still vital and have many years to go. If you look at Ron's PubMed stage, I think it's fair to say if he's not the most prolific in our field right now, he's certainly in the top three. I'm counting 142 as of last note. He's been doing this for 20 years, if you look at this little graph. But Ron, what happened in 2014? You had this great pace going, and you must have, taken a sabbatical or taken a year off in 2014. But to be sure, Ron is as productive as they come in our field of research and consulting and health promotion. This project that you're all going to learn about today from Ron and Emily is really making the news. In Fortune magazine, just a few weeks ago, one of Ron's colleagues, Bill Kessler, was one of the co-authors with two other leaders in our country talking about that it's time for a public health priority in terms of business having a role in that. And then just a day later, Forbes magazine also had a wonderful article about what we're going to learn about today, the 7 ways business can align with public health for bold action. And this is really quite a fulsome interview with you, Ron. Another place you can find that, if you're like me, you like to take the news with you on a walk. There's a podcast with Jim Purcell that goes into details with Ron about what he's working on and about this work. At the de Beaumont Foundation, we're so interested. Our next Hero Think Tank on June 7th is called The Rabbit Hole. This is for our Hero members, where we're asking about the employer's role in disinformation. I don't think we can talk about the crisis and the opportunity that comes out of it without thinking seriously about why is there such crazy variation in terms of people's resistance to the vaccine. And your boss, Emily, Dr. Castrucci at de Beaumont, is really making the news a lot. And he's been doing focus groups and really been consulting with people about, in this case, why Republicans want facts, not emotion. So I think we're going to stay on that topic. Before I turn it over to you, Emily, it's never too soon to remind our audience that Hero 14, Hero 21 is going to be in Austin, Texas this year, and the week of October 11th. And again, germane to our topic today, how do we turn crisis into opportunity? Well, we're calling our theme bouncing back, boosting mental resilience and building organizational immunity. And so we, like you guys, think we're right on topic in terms of what we need to be doing together to reimagine health promotion in our role. So with that as a modest and brief introduction, Emily, let me turn it over to you. Thank you so much for joining us today. And we look forward to your presentation with Ron.
Great, thank you, Paul. And thank you so much to the Hero family for having us here today. On behalf of the De Beaumont Foundation and Ron with Johns Hopkins University, we feel very honored to be here and hopefully share some behind the scenes insights and things that we learned throughout this process focused on the alignment of business and public health, which I think is something that drew you all here today and keeps us working together towards a shared mission. So I'm going to kick things off with a brief 30-second video that I think will really set the tone and the stage. And then after that, do a little tee up of why we got involved in this work before handing it over to Ron. So I'll just share screen. If you can bear with me for 1 second. All right, here's the video. Kept it short and sweet for you all. Move that. So yeah, good health is good business. And that's what really drew not only the De Beaumont Foundation, but also Johns Hopkins University together in this shared mission to help draw attention. And a lot of this had been going on pre-COVID and pre-pandemic, but really, as I'm assuming might be the case with you and your teams, it really lit a fire and really sparked the need and urgency to really address this in a formal manner. So I'll tell you a little bit about De Beaumont Foundation. Essentially, the context for this, since we normally don't engage with the Hero audience as much, we're a private foundation. We really focus on policy, partnerships, and people when it comes to strengthening public health infrastructure in America. And so whenever we get the chance to work across sectors, which is really the impetus for the portfolio that I manage at the Beaumont Foundation on partnerships, we're really looking at how can cross-sector partners work together to, again, strengthen public health in America, which I think we can all agree has been under-resourced and in some respects undervalued. And the pandemic has really shined a light on that. So here's a little bit more about De Beaumont. You can see how you can find us and follow us. And I'd love to keep in touch with the Hero team after this. So here is a quick graphic, right, that I thought was important because the COVID-19 pandemic has really made clear the indelible link or the relationship between economic well-being and the health and well-being of our country. And this graphic here was based on a study that shows, US employers spent about $530 billion a year on everything in terms of wages and benefit, but also things like absenteeism or conditions that might be related to a worker or employee having poor health. And so this really shows you that in the study, I have a stat here that poor health really costs businesses about 60 cents for every dollar they spend on healthcare benefits in the United States. And so really, the lesson learned, again, that COVID has shined a light on is that our safety, security, and economic prosperity are really dependent on a robust public health system. And as business leaders, what's so incredibly exciting and why Ron and I are really happy to be here with you today is to just spotlight this unique opportunity that you as business leaders have to really inform and advance efforts that not only affect your own organization and employees, but also the community that you live, work, and play in. And so this is just a final slide from me around the three things that we've really worked on very closely in addition with Ron. The first is the Good Health is Good Business report. Ron's team really helped us, along with the Bipartisan Policy Center, lay out the value proposition and what is the case to be made for alignment. And then just recently, as Paul kindly teed up for us, we worked together on the 7 Ways report that Ron is going to dive much deeper into, where we actually got to speak with 40 top business and public health leaders in the midst of the pandemic to see what they were doing, how they were thinking about, adjusting and working towards better health, not only for their employees, but their community as well. Ron actually did a Washington Post Live along with Brian Castrucci from the de Beaumont Foundation. So I'm happy to share that later too. It's all available on this website. And then one last resource before I turn it over for a poll, but then also to Ron, is the Health Action Alliance. So this actually is a great resource. Again, you can find the link on this website for businesses that are really interested in tangible materials, toolkits, and templates to help them engage with their employees and other stakeholders, whether that be the supply chain or customers or employees. And again, you can see here we have several key partners, including the Business Roundtable, participating in that. So that's a little bit about de Beaumont Foundation and why we got involved, and feel so lucky to work with Ron's team at Johns Hopkins and to be here with you, the HERO team. So I'd love to open up some poll questions. I just have 3 for you to tee things up, because we'd love to know where you're coming from and what you're looking to learn from this before Ron sets up his part of the presentation. So hopefully we can directly address those. So if we could, there we go, perfect. So you can see here, how is your business working with local and state health departments to be better prepared for public health emergencies? We'll keep that open just for a second until we've got some responses. All right, do you think we have enough responses there? Let's see what the results are. Oh, interesting. Okay, so 47%, my eye went to that with the red bar, all of the above, followed by, it looks like, supporting employee health and well-being in particular as it relates to COVID-19. Okay, very helpful, thank you. And Ron, it might be worth noting the 14% are not currently working with their public health departments. All right, so let's go to the next question here. And if you don't mind, Ariane, opening, thank you. Having experienced the pandemic, what is your organization's priority in terms of better preparing for future crises? And again, these are all anonymous, and we're just looking at the aggregate results.
And just a note to Emily and Ron that we're certainly going to be coming back towards after Ron's presentation to discuss these together, because these are learnings that we're all enjoying together in terms of how employers are responding.
Yeah, indeed. Thanks, Paul. All right, I think we might have enough answers. Let's see, how did you all respond? Okay, interesting. Okay, 59%, the red line there, focusing on telework and telehealth. Followed closely, 49% investing in efforts to support healthy communities where employees reside. I'll just say, from the public health standpoint where de Beaumont sits, that's a really strong number, and clearly a testament to the HERO work to pull together this alignment. So that's fantastic. All right, why don't we go to the last question that I have for you? And again, Paul mentioned there'll be others to follow. So if we could open up this one, great. So as we recover, as Paul noted, that light at the end of the tunnel, how is your organization thinking about employee health and wellness in terms of concerns? What comes to top of mind for you and your organization? And this one might be more, I don't think we added in all of the above, which would certainly be a fair response, but if you could tell us what is the primary focus, that would be helpful. Okay, I think we might have enough answers. Okay, thank you. So yeah, mental health came in with a strong 36%, followed by exhaustion, burnout. And I'm sure that is relevant not only to you individually, but to your employee health. It's incredibly important as we think about what's next in this pandemic cycle. So why don't we close that poll results? And I'm gonna stop sharing here and turn that over to Ron to dive deeper, not only into your responses, but also the 7 Ways report.
Thank you, Emily, and thank you, Paul and Ariane, for giving us the opportunity to present today. Let me put up my presentation for all to view.
As you're doing that, Ron, just a reminder that finding about mental health and burnout is so affirming of HERO Forum, again, for our week in October, that the second wave, as it's often referred to, is clearly underway, and that a lot of the sessions that we'll have at Forum this year are about mental health. So that certainly affirms our direction.
Great. So as many of you know, a long history with Hero going back to the 1990s, and my focus has been primarily on employers and the business community and what they can do to improve the health and well-being of their workers. In the good old days, about 150 million Americans went to work every day, a huge population that we could potentially influence in a workplace setting, and a huge opportunity for employers. But at the same time, I'm also a faculty member at the Johns Hopkins Bloomberg School of Public Health. So the question has always been, how do we integrate these worlds, that typically don't talk to one another, typically don't communicate with one another? And so we worked with Emily and the Beaumont Foundation to try to blend those two worlds together in this report entitled 7 Ways That Businesses Can Align with Public Health, Bold Action and Innovation, Turning Crisis into Opportunity. And for those of you wondering, by the way, on the right, that's a Paul Magritte painting, a famous surrealistic artist in Belgium. So, we're definitely in this situation where there's life before COVID and there'll be life after. It's really a clear demarcation in our existence. Personal lives, professional lives, family lives. Certainly we can probably think about the moment when things stopped being normal, sometime in the spring of 2020, and where we are right now, kind of the world after. Not only do we have the pandemic crisis, but we also have social unrest. Paul is in Minneapolis right now. We're kind of reliving the George Floyd episode that occurred some months ago, and a collapsing economy, which hopefully is being revitalized, but we're still in the middle of all of that. So all of these things are happening all at the same time. And, kind of brought to mind Peter Drucker's famous quote that says, "A healthy business cannot exist in a sick society." And then another very famous quote that came from Mayor Rahm Emanuel, "You never want a serious crisis to go to waste. It's an opportunity to do things that you thought could never be done before." And so we were thinking about this, and we had worked with Emily and the Beaumont a year earlier, as Paul mentioned, with the Bipartisan Policy Center. And at that time, we produced this report, Good Health is Good Business, and we put forth a bunch of recommendations in that report. Said this is how we can bridge that divide, the gap between the business community and public health community. And we talked to a lot of people about that. And on the list as a recommendation was prepare and ask. And ask is something that you hear a lot in the business community, kind of, what are you asking me to do? So the ask that we came up with, which was essentially what public health would be asking the business community for, is to answer the following question: how do we best address COVID-19 pandemic today while also preparing for future public health crises? And we were thinking about this in the spring of 2020, and had a conversation with Emily and Brian Castrucci and so forth, and said, we have this window of opportunity right now where we can probably bring together virtually in a room a lot of very thoughtful people in public health and business, and basically open-endedly ask them that question, and not ask for a lot of time, 45 minutes to participate in these focus group discussions. How would you answer that question? And we got a lot of answers, by the way. People were actually quite eager to give us their opinion. Some had not even kind of contemplated that, having come from the public health fields, saying, really, we want to ask business to do something? And the business people said, what? Public health, what is that again? And we compiled, I think it was about 50 pages of notes from those discussions. And then our task was, and this was a very short period of time, it was about 2 or 3 months that we had these discussions. Our task was to come up with some basic ideas, recommendations, not to inundate the audience with a lot of ideas, but funnel them down to some central themes. So we came up with these 7 broad recommendations, and I'm going to go through them in a little bit more detail. But basically, number 1 is put out the fire. Number 2, which is what we're all about anyway, which is improve the health and well-being of your employees. Number 3, extend beyond the workplace and improve the health and well-being of your communities. Number 4, become a force multiplier. Number 5, facilitate partnerships between business and public health. Number 6, set up accountability dashboards, make sure everybody's achieving the ends, the goals that they are striving to achieve. And then finally, 7, advocate for rebuilding and expansion of a public health workforce with an underlying infrastructure of technology. So infrastructure has now become a hot topic, and I think there's a role there for public health to be part of that infrastructure. So number 1, obviously put out the fire. We have COVID-19. It is still, actually the latest statistics I just looked at, it's now in an uptick again. It's crazy. So the role of employers, of business communities, to publicly amplify or support, implement science-based recommendations seems basic to us. Wear a mask, observe social distancing, meet outdoors, wash your hands, get a flu shot, test, trace, socially isolate, get vaccinated, and listen to credible sources. And among those sources are Harvard, Johns Hopkins, CDC, Public Health Communications Collaborative, Health Action Alliance that Emily mentioned earlier. And importantly, identify the one go-to person in your organization for credible information. So instead of people kind of going to Google or some other places to try to get information, make sure there's one place they can go where they can get kind of the straight answer, and make sure that person is someone who's trusted and credible within your organization. But also at the same time, weave communications about COVID, I don't know what I just did, into your general communication material. So you're constantly communicating to your employees, you've got advertising campaigns, you've got marketing. You can do this kind of messaging in the stuff that you normally routinely do, and you actually have a budget for doing this. So off on the right-hand side, we are advocating that you make heroes of public health workers. We certainly applaud and bang on pots and so forth when frontline workers, health workers come out after long days of shifts. But what about the people doing surveillance, the contact tracing, the epidemiologists, the people in the background? They need to become heroes as well. All right, number 2, improve the health and well-being of your employees. Only you can prevent forest fires. Only you can improve the health and well-being of your employees. So obviously there's a lot of materials that we've generated over many decades, publicly available health promotion tools and resources to design, implement, and evaluate impactful workplace programs, coalesce resources across departments and functions in your organization to improve health and well-being. There's no reason why there ought to be all these separate departments trying to do their own thing without coordinating communication with one another. And then for large enough organizations, or for those organizations that want to find contract medical officers, empower your chief medical officers or chief health officer or chief public health officer, kind of a new term, to provide expert guidance on managing COVID-19 pandemic and other health risks inside the organization, things that you can be doing internally for your own workforce. And again, that's a lot of what HERO and other organizations like HERO have been doing for the last 25 years. Here are some basic resources that are out there, including the HERO scorecard, the C. Everett Koop Awards, the CDC scorecard, the American Heart Association scorecard, total worker health, and so forth and so on. There is a lot of stuff out there that I'm sure this audience is very well aware of. Use those resources because they actually do work. All right, go beyond the workforce and extend.
Ron, I'm sorry, this is Emily. I think your slides might be frozen. That's what Paul was just about to say. We're still on, there we go, there we go.
Oh, okay.
We see City Health.
I hit the wrong button at some point, and I apologize for that.
All right.
Okay, so you can
Looks
see
good.
City. Good, good, good.
Yes.
Good. All right, thank you. Zoom, still getting used to it. All right. Now, employees go home. They've got families. Families live in communities. You don't want to live in the toxic community, even if your employer provides you wonderful healthcare programs and benefits. So the idea here is to improve the health and well-being of your community. support efforts to explain the value and importance of public health beyond COVID-19, because obviously we are in a sea of other risk factors that are affecting our health and well-being. But then advocate for evidence-based public health policies that build and sustain healthy communities. And this is part of the Beaumont Foundation, a city health initiative. Very simply, it's a scorecard, it's a report card on 9 actionable initiatives at the community level that are actually evidence-based and primarily apolitical, bipartisan in nature, like affordable housing, sick leave, food safety, ability to have universal pre-K kindergarten, tobacco 21 policies, which are now in all communities. And what this is basically is it provides a scorecard and gives medals out to large communities around the country that have adopted these policies that are verifiable. So work at the local level, the community level, to get your community to adopt these policies. The next recommendation is to become a multiplier. So you've got a lot of resources. You know, if you're a marketing company, if you're a high-tech company, if you're a transportation company, you know, whatever it is that you do, you've got a lot of resources in-house. So expand your volunteer and pro bono activities and make those available to your local public health agencies. You may want to think about inaugurating community-specific public health shared value consortia. What's the big issue in public health in the community? Get employers together, work with public health, and focus attention on those things. And recognize and reward early adopters. People love to be recognized. We've got a picture here from a Hero forum where we handed out the Coop Award. People love to get their pictures taken. People love to receive awards, put them in display cases, get in the newspapers. So let's reward and recognize those organizations, those leaders in the business community who adopt these programs. Partnerships are incredibly important. And again, I'm always amazed that how few businesses engage with public health agencies in the community and vice versa. Public health people are often averse to and sometimes frightened of business people. So you've got chambers of commerce, you've got coalitions, and then you've got public health departments and public health agencies and advocacy, and they don't go to each other's meetings. They don't listen to each other. And one idea that's been around for a little while is to actually get someone named a chief health strategist in that community. And that person, who may be trained as an MBA and MPH, actually that person's job is to bring together business people and public health leaders to work on common issues and common problems. So go to each other's meetings and take advantage, by the way, of anchor institutions. There are a lot of anchor institutions out there in America. Oftentimes they're hospitals, they're educational institutions, universities, and public school systems, or even the state and local government are huge organizations that can have a lot of influence in that community. Those are the people who are business people sitting on the boards. They have a lot of political influence. Take advantage of them. Accountability is clear. I mean, all of these things sound good on paper, but unless you have the measures and metrics to see whether they actually work or not, you know, it's all quite futile. And the idea here is to connect and combine employee health, community health, business health measures on a common scorecard or dashboard. And there are different ways of doing that. Here are some examples that are out there, but why not? And there are some cities out there like San Antonio, Texas, and Nashville, Tennessee, and a few others that have actually produced community-wide dashboards that deal with both business and public health metrics on the same dashboard, and they keep track of that. So if you don't measure it, you're not going to be able to manage it. And finally, increase your public health workforce and the information technology infrastructure that it needs. Again, we're talking right now about infrastructure, but it goes beyond roads and bridges and irrigation and water systems and sewage systems and even broadband. It really does include public health infrastructure. So part of that is just building up the number of people who are available, the core. So we do have a U.S. Public Health Service Commission core. That's where the U.S. Surgeon General sits. Why not have a reserve corps like in the military for public health, and then a public health jobs corps, hiring 100,000 people at all levels from high school all the way to medical training who can provide public health interventions in the community. So the question, of course, is how do we fund this? And we're right in the middle of big debates in Congress and elsewhere about spending money and what do we spend it on and how do we spend it on? And there are lots of great proposals out there. Interestingly enough, there's an article by Karen DeSalvo, who's now at Google. I showed you a picture of her earlier. She and Jeff Levy put together an article a year or so ago that basically estimated to rebuild our public health infrastructure would, quote unquote, only cost $4.5 billion a year. Now that sounds like a lot of money, but not when you compare it to the $6 trillion, literally $6 trillion that we have spent so far on this pandemic. And imagine how much that money could have been spent to prevent all of the pandemic overflows that we are now experiencing. It's really quite remarkable. So bolster the Public Health and Prevention Fund. There is actually provision in there for public health. Think global, but act local. There are many, many things you can do at the community level, the state level, and support public health infrastructure policies that are being advocated. So to review, this is what these 7 recommendations are as explained to a 10-year-old. If you have to explain it to one of your nieces or nephews. Number 1, put out the fire so I can return my business back to normal, bring back workers, reopen facilities, rebuild the economy. Number 2, improve the health of my employees. That's lower healthcare costs, lower absenteeism, fewer accidents, less disability, more present workforce. Number 3, improve the health of my community. Means I can recruit and retain talent, people who want to live where my facilities are located. We have better schools, less crime, we have recreation facilities, good transportation, affordable housing. Number 4, if I contribute my company's skills and expertise, know-how, I can multiply the effects of public health efforts in my community. Through volunteerism, I'll be viewed as caring for my residents' health and well-being. Number 5, if I partner with public health, I get a seat at the table when big decisions are made. And that means I know what's going on and may even influence those decisions. Number 6, accountability is key in my organization. For myself, my board, my shareholders, I want to make sure that we're all accountable for the decisions we make and the money we spend. And number 7, we need good paying jobs in the community. And people need the skills and resources to do their jobs well. And that's why growing a public health workforce is necessary to take some of the load off of my shoulders. And so end it all with this very, with this baby saying, what did you just say? Well, that's a lot. So the asks that we offer here, number 1, endorse or sign onto the report, the de Beaumont report that we showed earlier. Here's a link where you can go on and actually say, yes, my organization supports this, we believe in this, and even offer a quote. As we've done, co-author an op-ed piece. Bill Kastler did that from IBM, Pam Heimel, Brent Pilecki from Goodyear, to offer your point of view on this issue. And it can be your perspective, your company's perspective, connect to media and journalists, host and join a podcast, as I did with Jim Purcell, organize like-minded professionals like chief medical or health officers, other health and well-being professionals to discuss and act on some of these recommendations. And then finally, advocate for specific recommendations or actions at the local level. And with that, I'll stop my presentation, and I think we're going to open it up with some more poll questions, right, Ariane?
We are on, and you can go ahead and unshare your screen, because I think the poll questions are full enough now when I tee up the polls that I think we should be able to see them just fine. While I do the first one, Emily, let me start with you and remind you that your colleague Brian Castrucci was one of our keynote speakers at Forum in 2019. He did a wonderful presentation, including what Ron just wrapped up. He described dashboards that you all have been monitoring for years of the Healthy Cities movement. And so he's got his advocacy that he's been doing for years about what it takes to build a healthy city. If you were to reflect on what Ron just presented, and in particular, knowing that your audience today is mostly employers and people who work with employers, how do you bifurcate between the public health infrastructure, as we traditionally think of it in these cities, the leadership, especially the political leadership in these cities, and the role of business. Could you reflect a little bit on how those three do and don't interact in what you know to be some of the healthiest cities in the country?
Sure, happy to, Paul. Maybe I'll start by approaching it in a macro level. There's this idea or this analogy we usually like to use about how good health is really like the foundation of a house, right? In one's house, if you find a crack, even the smallest little crack, you really don't want to let a crack grow in your foundation because heaven forbid, then the walls start to slightly tilt and the floor starts to, and so on and so on. And that one little crack starts to grow and become something much, much more serious. And to Ron's point about the dollars that it takes, right? A little investment at the beginning to address the crack would have likely prevented a much more intense cost down the road. And so in a similar way, when we engage in, there's a number of great collaborations. For example, I'll mention in Kansas City, Missouri, Scott Hall at the Chamber working with Rex Archer in the Public Health Department several years ago on Tobacco 21, right? There are these great alignments. And even Brent Pilecki, who Ron mentioned with the op-ed over at Goodyear in Akron, Ohio. We had a chance to go visit with him. He was kind enough to invite us over to talk about what they're doing. And he's actually assembled, as an example, not only the Goodyear, but also several of the hospitals, as Ron mentioned, some anchor institutions locally, as well as local business institutions and other community groups. So they'll come together and meet periodically, and the important key here is not just when there's a crisis, right? But they have been building these relationships slowly and generally over time so that they can build trust and have a relationship. And then where the rubber meets the road, not no pun on Goodyear, but where the rubber meets the road, we've had several groups call us and say, when COVID hit, we actually knew who to call and had a direct number to the public health department to actually talk about how should we work with our employees. What is the messaging and what's going on with the vaccination just in the short term. So those are just some examples about how, we have seen communities work really successfully together.
Yeah, thanks, Emily. All great examples. Hey, Ron, I'm going to turn to you next, but while we're doing that, let's pick up on the middle category of recommendations about credible sources of information. And we're trying to, again, bifurcate here the role of the employer versus the public health and science community. At my organization, employees are susceptible to disinformation and distrust in science and authorities in general. And it is an issue when I say we, I'm talking about employers represented in this session today. It's an issue we employers need to address. So you've gotten choices there between strongly agree to strongly disagree, all the way from you don't even see this as an employer issue to, yeah, we got to really be after this. So Ron, it's not, you've worked in both the public and private sector, you're public health trained. To my ear, it's not unusual for employers to abdicate, that they are busy running a business, they're busy trying to take care of their own culture and their own employees. And they kind of, I think, at least historically have said, well, isn't this public health stuff for the public health community? How do you respond to that as someone who works at IBM and Johns Hopkins as well?
Well, it's interesting, the Business Roundtable back in August of 2019, before the pandemic hit, basically came out, this is 180 some odd large corporations, and said, we're certainly, we need to devote attention to our shareholders, but also to our employees, our customers, and people in the community. And they did this before this crisis occurred. I think what this crisis has done is really brought to the forefront the interconnectedness between the health and well-being of society and the health and well-being of the economy. Where the crisis, the 2008, 2009 crisis, the financial crisis, it was mortgage payments, it was banks, and it seemed like, okay, that was contained, but this is affecting everybody, everything and everybody. And it really came to the forefront that everyone is being affected one way or the other. And we need to address it. Now, unfortunately, it turned into political debate, and information, disinformation is obviously emphasized here. So it's so important to get credible information. And I think some of the focus group stuff with Frank Luntz and de Beaumont really highlights how you communicate to diverse audiences so that they trust you.
Yeah, I'm going to stay on that question for you, Emily, but first a reaction to the results of this first poll. I'm not surprised by this. There's ambivalence here. I don't think anyone disagrees that disinformation is a problem. The issue is whose problem is this to solve? And I'm not surprised to see 30% saying, well, it's not really a priority for us yet. So that's encouraging. And then a good 20% are just disagreeing or strongly disagreeing that this is the employer's job. And so, we can certainly glom on to those 40% who agree. Emily, I'm going to ask you about where Ron left off a little bit in terms of partisanship on this issue, but any surprises from you or Ron on the results here?
I mean, I'll chime in. We're working with one employer here in the Washington area who is regularly communicating with employees all the time about this and having webinars and videos and all kinds of stuff to constantly reinforce the message of we as a business, we're all together, we're all in the same roof, we all have the same purpose and mission, and here's what we believe and here's what we think everybody ought to be doing. Mm-hmm. So I think constant messaging communication to get over this disinformation and distrust obstacle is so critically important.
Yeah. Hey, Emily, I'm going to turn to you next, but let's have them work on this poll while I launch this question your way. I appreciate that this is not an either or and that you wish there was a both and choice here, but just to try to, again, get information from this audience about their leanings, your thoughts on the best go-to spokesperson. Ron talked about the incredible importance about credible information. He pitched a chief medical officer or chief health officer, an internal resource who could be influential with the external resources, or I think external resources, back to this question of whose job is this to solve. CDC, local universities would be more influential. So I'm going to wait on that poll. But Emily, like de Beaumont, HERO is bipartisan or nonpartisan to a fault. We certainly don't want to get in any horse races with any parties about what's the truth in terms of health and well-being for the nation. But your boss, took on that very question and said, what's up, with the Republican resistance, and did focus groups. Can you share a little bit? Because the reason that this is important right now is, again, June 7th, for those on the call who are HERO members, we're tackling this question as much as I'd never recall a think tank HERO put on where we would, even tread a little bit into partisan issues. This is an elephant in the room. I don't know how we can not talk about disinformation without reflecting on the big gap, the big differences between parties. What did you guys find, Emily? Can you share a little bit about what the learnings were from those focus groups?
Sure, happy to. And the context was we at the Beaumont Foundation teamed up with Frank Luntz, who does a number of polling, research, et cetera, and is well known in the conservative leaning organizations and issue areas and media outlets, right? So we had not usually worked with Frank in the past. And so this was a new opportunity and one that we thought was important to undertake. And really, Frank and the Beaumont Foundation were able to uncover through a focus group, which to clarify, right, there were about 20 individuals who identified as Republican or conservative leaning. Some were from rural communities, some more urban areas. So again, small group, but what was critical there was the fact that we were able to bring them together, have several elected leaders and officials also participate, as well as Dr. Frieden, and listen in and not only understand and hear from these folks, what were their concerns, where were they having issues of mistrust or distrust, and then more importantly, how did they respond to certain messages that were already being floated or things that had not yet been tested. And so the response was, and where we netted out, if I could just summarize, because again, there's a lot more to unpack here and I don't want to overgeneralize, but if there were just a couple takeaways, it's that vaccine hesitancy in any group, but specifically for this one, since we're focused on them, there's nothing wrong with that, right? We feel, I think all of us at some point had some, questions about the vaccination, how will it affect me? How will it affect my community? And the point is that's okay. But if you don't ask the questions and don't have a trusted person to talk to, whether that be your employer or somebody in your community, maybe faith-based or education in school, how then will you get your information? And I think Ron actually mentioned, instead of Googling it and leaving it to the internet to provide answers, try to find a directed resource. And I'll just add, in case you're curious, because HERO folks listening right now as employers, there was a survey by Edelman, very well established, very well recognized survey that said employees trust employers far beyond even government or other entities. even family members, I believe. That might have been the one to have parity, but employers really hold a very vaulted and special place when it comes to being messengers, not only for the pandemic, but more topics in general. So I'm just hopeful that after this session, it really helps you find a way. Again, Ron has mentioned a number of resources, as does Hero have, that can help you provide those answers or be a conduit for communication.
Well, here are the results. It's exactly a 50-50 split. In fact, for a while, I let it sit there because it was right on 50-50. And I wondered if it would tip you guys, but it's basically 50-50. And it affirms what I said in this poll. We didn't allow you a both and. I think you clearly would have said it's both of these. Ron, does this evoke a dilemma, or does this encourage you that people think internal is as important as external?
You might even say the best of all worlds is both, right? So internal communication, underscoring, reinforcing what is coming from a credible source like the CDC is the best way to go. In fact, the employers we work with basically won't shift their recommendations and their processes very much from what the CDC is recommending. Because you don't want to go out on a limb and say, well, instead of this symptom, we should go with that symptom. You don't want to go there because it's, you're not credible if you start futzing around with it.
Mm-hmm. Yeah. In fact, Andrew agrees with you. One of his comments, it was poll questions are not allowing for gray areas. If we think it's a problem about communicating to encourage trust of experts and scientists, messaging has to combine both internal and external resources. So he's affirming that. Let me launch another one, and I'm going to turn to you, Emily, with a follow-on. This one we're asking, again, based on your report, post-pandemic, my organization will invest more in employee health and well-being. Strongly agree. We're doing it. We're in the works, or that's the plan. We're not sure. Just strongly disagree. And while we're waiting for that, Emily, one of the things that has been so clear, actually two things have been so clear all year. One is health disparities have been so exacerbated by this pandemic, and the light is shining more brightly than ever on disadvantaged communities of color. Preferentially, this is not a indiscriminate virus. It is discriminated mightily. And then secondly, the health risks that are attendant to this pandemic. People with high health risks are also succumbing. One would think that would have us reimagining or re-upping our investments in health promotion, particularly in those two areas, our highest risk employees and seeing how vulnerable they are, and our people of color. Are you seeing examples in communities where this pandemic is a wake-up call?
Sure. I mean, in terms of inequities, and I'll even, go the extra mile to say, I think racial equity and even racial justice, and peeling back the very important layers of what is causing and what is at the root cause of some of these social determinants of health that really are exacerbated by the inequities that you mentioned, right? So from the public health, and let me just set the context, right? I know we have some public health professionals and leaders on here, so I would never claim to be myself a public health, spokesperson. But I will say, from the access and the privilege that we get to see in working with communities, we see a lot of communities using the pandemic in this, I hate to say silver lining kind of way, but we've heard from both public health departments, hospitals, and community-based organizations, and even residents groups that are using the pandemic to signal to their community leaders, especially policymakers and others, that this really is a need that needs to be addressed, right? For all the various reasons we talked about. And so if there can be something, if there is a moment in time, Ron mentioned those three sort of factors that are sort of contextually coloring this. This really is a wake-up call for any business leader. And we talked a little bit about the financial reasons to do so. I shared that stat about the $530 billion up front. But when you look at what's next and where we're going, I think to ignore the inequities around here, not just from a social justice movement, but also from a health equity perspective, would be, selling yourself short in terms of the opportunities your company can make to invest in better health for not only your employees, but better success for your company.
Yeah. Ron, what do you make of these results?
Well, I mean, I'm gratified to see that there's a very small number of disagrees out there. That I think this has prompted organizations to look internally to improve the health and well-being of their workers, and we are now, of course, pushing them to go beyond the four walls of the organization to look at the health and well-being of their community, because that's where their employees live. So I'm encouraged by these results.
Yeah. So we have time for just one more poll, and then again, Ron, let me ask you the next question while we're waiting for the results on this one coming in. Post-pandemic, my organization will fundamentally reimagine our approach to health and well-being with new and different priorities. Is very much the theme again of Forum in October in Austin. So selfishly wanted to get this poll out there before to see if people are going to come to get the answer to this question. But I think this is for both of you. Ron, you and I are both trained in public health. To my ear, when we bring up race as a social determinant of health, it's often felt to me that it's kind of subsumed within all the other things like class and income levels and geography, and it's just kind of one factor. I think to my ear, for the first time in the last couple of years, racism has been the distinguishing discussion now, that it's not, some genetic predisposition, it's not some proxy for income or education. It's actually the societal ill of racism that is the differential that's creating ill health. Are you hearing that differently as well? And how are you feeling about the science and our ability to sort of get good science behind that question?
I agree with you 100%. I think racism is a core issue in social determinants and maybe one of the most powerful and important issues out there. There is hesitancy among some in the business community to say that because, again, the political nature that we're living in right now. So they instead will talk about health equity and racial justice and diversity and inclusion, all of which are excellent and good. And, and I just saw, actually, I think there were 50 or so CEOs or ex-CEOs of major Fortune 500 companies that came out strongly on this position. And the more we get it out in the open, the more we talk about it, the better. But if the way you get there is by talking about health equity, fine. Let's go that path if you're more comfortable doing that. But we know underlying it all, there is racism, systemic racism in this society.
Yeah, and Emily, I'm going to give you the last word on this, and for the session, I'll have you react to the agreement. It's time to reimagine it. And let me just kind of stay on that really basic and important and difficult question and have you wrap us up for the day. I agree with Ron. I do think that people couch it for politically correct reasons, if not just personal anxiety reasons. Is that troublesome in some ways in terms of our tendency to not be able to talk about racism more explicitly as a health promotion challenge that we have to get after? I think I'm encouraged by people saying strongly agree, it's time to reimagine how we do this. Should being explicit about racism and caste and the like be more ascendant in your view in terms of how we tackle this? Or like Ron's saying, is it better to kind of couch this? Or I don't think you're saying it's better, Ron, but it's a tendency we have to couch this to try to make us more comfortable. What's your advice on that?
Sure, and I'll agree with Ron. Actually, I think his comment, what we're seeing, the reality of how some companies choose to address this, and I'll just say, I think any effort to address this and whatever term they use, I think that's a good start, right? I would never want a company to shy away for concerns or whatnot. But, I think everybody on here probably agrees, right? No matter what an issue is, you can't address it unless you name it, unless you talk about it, unless there's transparency behind there. And so where this intersects in terms of public health and naming racism and calling the system out and really dismantling it, if we're being honest here, right? How do we dismantle those systems that have perpetuated these issues that inflamed, as we saw what happened during the pandemic with inequities? There's this idea of, the community and having them be centered and co-develop these as well. So business, I think, has a responsibility, and we're seeing businesses and corporate leaders actually take stronger stances in a number of issues. And so I think it'll be interesting to see what the future holds. I will say this report, the 7 Ways report, really tries to give business leaders that roadmap, right? So whether it's starting out from a putting out the fire, because as we mentioned, again, I hate to call it a silver lining, but more of an opportunity to reimagine what's possible because of the window that COVID has opened. So even from the short term putting out the fire, all the way to investing in communities and longer term programs that can support public health infrastructure. That really is a roadmap, which is undergirded entirely by the equity issue, because you cannot make progression along that without equity. So I think there's many different ways to tackle this. And I would just encourage business leaders, if you are looking for ways to address it, and Ron and I have been so lucky to find peer groups that are having these open conversations, not only at the Fortune 100 level and small business, but everywhere in between. And we'd love to pair people with those groups if they're looking for support, backup, or resources to have those conversations and strengthen their business. That's what it all comes down to.
I'm reminded, Emily, why partnerships is in your job title. You are such an eloquent spokesperson for the need for us to get together on these issues.
You.
Emily, you from Demont, thank you so much. Ron Goetzel from IBM and Johns Hopkins, thanks so much. Wonderful session today. We really appreciate your leadership for all of us.
It was a pleasure. Thank you for having us.
Thank you all for having us for this presentation. Appreciate it. All the very best, everybody. Take care.
Right.
Stay well.
We're adjourned. Bye-bye.